My name is Amanda Jelinek, and this is my final head to toe assessment video. I'm going to start by scanning the room. Alright, before entering my patient's room, I would check the chart to make sure I had the right patient and to follow the correct physician's orders. Once I enter the room, I would provide privacy by closing the door or closing the curtain, and then I would perform hand hygiene by washing my hands with soap and water, and I would introduce myself to the patient and identify them. Hello, Ms. Howard. I'm Amanda. I'll be your student nurse today and doing your assessment. Can I go ahead and see your wrist, please? And can you tell me your name and date of birth?
Lauren Howard, 10/1995.
All right, thank you very much. And can you tell me where you're at today?
Flushing, Michigan.
All right, and do you know the date?
November 26, 2018.
All right. And what brings you in today?
Just a checkup.
All right. Are you in any pain today?
No.
No. And are you on any type of medications?
No.
And do you have any allergies?
No.
No. Okay. Just looking at my patient and talking to her now, she seems alert and oriented. Times 3. She knows where she's at, who she is, and when it is. She is dressed appropriately for the weather. Looking at her facial expression, it is relaxed and appropriate. Her mood is calm and appropriate for the situation. She is neatly groomed and clean. Next, I'm going to go ahead and do my cranial nerves and lymph nodes and get them out of the way, and then I will continue with my assessment. Starting with cranial nerve number 1, that would be the smell. Do you have any history with your smell?
No.
Any issues? No. If she did, I could have her close her eyes and take coffee or garlic, put it under her nose, and have her tell me what it was, what the smell was. For cranial nerve number 2, it is for vision. Do you have any history of vision problems, any contacts or nothing like that needed? No blurriness or dizziness?
No.
Okay. If she did have any problems seeing, we could use the Snellen chart to test for that. For cranial nerves number 3, 4, and 6, we're going to do the 6 cardinal gazes. So if you can go ahead and follow my pen. Not moving your face. Alright, and those seem to be intact. With cranial nerve number 5, I'm going to have her, I'm going to check her TMJ. I'm going to have you open your mouth and close. And I do not hear any clicking. Was that any pain for you to do that?
No.
No? Okay. I'm also going to check her facial sensations. Just tell me where it is and if it is sharp, dull, or soft. Okay.
Sharp on my forehead. Dull on my left cheek. Soft on my nose.
Alright. And cranial nerve number 5 seems to be intact. For cranial nerve number 7, I'm going to have you raise your eyebrows and blow out your cheeks. Alright, and cranial nerve number 7 is intact. For cranial nerve number 8, I'm going to whisper in your ear and make sure you can hear me correctly. Have you had any history with hearing problems?
No.
Any dizziness? Any type of vertigo or anything like that?
No.
No. Okay. So I'm going to whisper in both ears.
Doctor. Patient.
All right, and I'm also going to have you stand up and close your eyes. And my patient is standing tall, no swerving or anything like that. She's not going to fall. And you can go ahead and sit down. Next, we're going to do cranial nerves number 9 and 10. And I'm just going to have you open your mouth and stick your tongue out and say ah. Alright, and the tongue is not deviating to any side. It did, the soft palate did rise above midline. And that shows that cranial nerve number 9 and 10 are intact. Can you also swallow for me? Alright, shows there's no gag reflex. Also, we're going to do cranial nerve number 11, if you can push against my arms. And turn your cheek, and on this side. Alright, and for cranial nerve number 12, we're going to have you say light, tight, dynamite.
Light, tight, dynamite.
Alright, and that shows that cranial nerve number 12 is intact. Now I'm going to go on to the lymph nodes, starting with the preauricular. I'm going to feel for any swelling or bulging, and this is the postauricular back here. Then in the very back is the occipital. Next, I'm going to feel on the tonsillar, submandibular, and submental. Next, I will do the posterior cervical, and the superior cervical and the posterior cervical. And can you bend your head this way? And I'm going to feel for the deep cervical, and on the other side. Again. And then if you can shrug your shoulders, I'm going to feel the supraclavicular. And there was no signs of any bulging, no swelling. Were any of those areas tender to you?
No.
No. Okay, that's good. Next, I'm going to do a little bit of musculoskeletal. If you could just stand up for me. And if you can place your heel on your shin and pull it down. And for the other leg, I'm also going to have you turn from over here and walk towards me so I can assess your gait. Alright. And my patient's gait is steady. She's not going to fall. She doesn't need any assistance. And can you can go ahead and sit down now. And can you place your finger to your nose? Alright. And next I'm going to go on to my assessment, starting with her head. My patient doesn't seem to have any bruises. Her head is normal cephalic. Her facial features look symmetrical. Her ears are symmetrical. Her top of her ear is in line with her canthus of the eye. Now I'm going to palpate the head. No bruises, no bulges or cuts on her head. Any of this tender?
No.
No. Her hair is evenly distributed and true to ethnicity for the color and texture. Her skin color is true to ethnicity. She's not jaundiced at all or cyanosis. Feeling her, she is warm and dry. Next, I am going to go on to her eyes. Looking at the eyebrows and eyelashes, they are evenly distributed and appropriate color for her ethnicity. Her pupils are round and at about a 4 on both sides. Can you stare at something up there and then follow my pen when it comes in? And her pupils are accommodating. Just gonna shine my light into them. And the pupils constrict. And the side. Doing it from the side shows that from her left side, the right pupil also constricts consensually. I'm going to do it from the other side. And the same with the right side, the left pupil constricts consensually. Looking at her eyes, the sclera is white, no opacities. Her conjunctiva is pink and moist. There's no excessive drainage. And next I'm going to go to her ears. Looking in the ears, there's no redness in this side or foreign objects. Same with this side, no redness or cerumen, no excessive draining. I am going to push on the tragus, pull on the pinna, and push on the mastoid process. And I'm going to do the same on the other side. Push, pull, and push. And are there any tenderness in any of that? Good. Next, I'm going to look at the nose. Looking at the nares, they are symmetrical. I'm going to close one side to check for patency. Alright. Her septum is not deviated or any perforations at all. There's no foreign objects, no excessive drainage. It is pink, no redness. Next, I'm going to move on to the mouth. Can you open your mouth? Looking at her lips, she doesn't have any sores or lesions. They are pink in her mouth. Her teeth and gums seem to be intact. No signs of any dental work. Her buccal mucosa is nice and pink and moist, as well as her pharyngeal wall and soft and hard palate. Her uvula is pink as well, and her tonsils are about at a 1. There were no cuts or anything like that. Have you been to the dentist recently?
Yeah.
Do you know when your last visit was?
Probably about 5 months ago.
And have you had any problems with your dental history, any surgeries or anything like that? Okay, good. Next, I'm going to go ahead and feel my patient's pulses, starting with the temporal. And that is about a 2+ bilaterally. Next, I'm going to move down to the brachial artery. And then to the radial. And those were all 2+ bilaterally. Next, I'm going to do I'm just going to go all the way down. I'm going to do the popliteal under the knees. Wait, move this so you can see. And on the other side. And I'm going to move down to the dorsalis pedis. And on the other side. And then I'm going to do the posterior tibialis. And on this side. And all of those seem to be about a 2+ bilaterally. Now I'm going to go, can't remember if I did the carotid, so I'm going to go to the carotid artery again. If not, those are 2+ bilaterally. While I'm on the carotid artery, I'm also going to listen for any bruise. I just need to fix my camera. Alright, I'm going to use my bell side on my stethoscope. And if you want to take a breath, and as you exhale, I'll listen. And on the other side. And again. Alright, and there are no signs of any bruise. Have you had any history of heart problems at all in family or for you? No. Any coughing or respiratory issues? No. Alright. Any chest pain?
No.
Okay. Neck. While I'm up at the neck, I'm also going to check the thyroid gland. If you could tilt your head forward and then lean to the right. I'm going to move this over. And then can you do a swallowing motion? Okay. And then the same onto the next side. And again. Alright. And the thyroid feels normal. It is not swollen or deviated at all. Have you had any thyroid issues for your family? No. Okay. Next, we are going to go ahead and listen to your heart in the 5 places. We're going to start at the second intercostal space of the right sternal border. This is the aortic valve. And then we're going to move to the left sternal border intercostal space for the pulmonic. Going down to the third intercostal left sternal border for the Erb's point. Down to the fifth intercostal sternal border for the tricuspid. And then do you mind lifting your breast a little bit? To the fifth intercostal midclavicular for the mitral. And S1 and S2 were present and normal beats, no irregular, no murmurs or any signs of that. Next, I'm looking at her chest. Her skin is nice and warm and dry, true to ethnicity. I'm now going to go ahead and palpate her chest. Any tenderness or bruising?
No.
Okay. Now I'm going to percuss her lung field. And the sound is resonance. Next, I'm going to go ahead and do tactile phlebitis. And every time I touch you, can you just say 99?
99. 99. 99. 99.
All right, and the sounds vibrated and diminished slowly as I went further down. Now I'm going to go ahead and listen to the lung fields. If you want to just take a deep breath each time I touch it. Okay. And again, the sound was resonance. No abnormal sounds or findings. If you want to go ahead and turn around, and we'll do the same for the other side. Looking at her AP diameter, it is a 1:2 ratio. I'm going to put my hands here and pinch and have you take a deep breath. And I'm also going to do it in the front as well because I forgot. Can you take a deep breath again? All right, and in the front, anterior and posterior, it was equal bilaterally in all lung fields. Back to the posterior, I'm also going to do the tactile firmitus on here as well. Every time I touch you, say 99.
99, 99, 99, 99.
And the sounds did diminish as they went down slowly. Next, I'm going to palpate the back. If this wasn't a real life situation, I would have my patient take her shirt off for the chest assessments, but I'm not going to make her disclose herself at this moment. So I normally would be under the clothing, just so you know. I'm going to percuss or palpate. Any tenderness?
No.
All right. She doesn't seem to have any bruising or anything on her. Her skin is still true to ethnicity, still warm and dry to the touch. Now I'm going to percuss. And the sound is resonance. Now I'm going to listen to the lung fields. Take a deep breath every time I touch. And there were no signs of any wheezing, any rhonchi. When I was percussing, I forgot to mention that I was going from C7 to T10, using the scapula as T7 to figure out where T10 was located. Next, I would go ahead and have you turn around. All right. I'm going to do the upper and lower extremities. I'm going to feel on your joints for any swelling, any tenderness. Let me know if you have any pain. I'm going to also have you lift your legs and do these. And your hands. And no swelling in her joints at all. Was there any tenderness in any of those areas? No. Okay. Next, looking at both of your upper and lower extremities, they are both warm and dry to the touch. There's no signs of any edema in either lower or upper extremities. I will have you take your socks off. I'm going to do your cap refill on your fingers and your toes. All right. And her cap refills on her fingers are less than 3 seconds. If you can lift your feet up, I'm going to do your toes as well. And her cap refill on her toes is less than 3 seconds as well. And you can put your socks back on if you like. On her hair, on her upper and lower extremities, her hair is evenly distributed, and the color is true to ethnicity, and there are no bruises or macules. There are a few tattoos on her right and left upper extremities. Next, I'm going to go ahead and go to the abdominal assessment. Have you had, how was your diet?
Pretty good. Pretty healthy.
No changes in your diet recently?
No.
No. You don't feel nauseous at all or have diarrhea?
No.
Anything like that? No cramps?
Mm-mm.
All right. And how is your urine? Do you urine frequently or normal?
Yeah, it's normal.
Normal, okay. No blood or mucus in the urine?
No.
No, and no burning sensations or nothing like that?
No.
Okay. What about your bowel movements? Do you know when the last time you had a bowel movement was?
Today.
Okay. And can you tell me what it looked like?
It was just soft and brown.
Okay. And you haven't had any blood or mucus in your stool recently?
No.
Okay. Do you have a history with any gastrointestinal problems for you or your family?
No.
All right. I'm going to go ahead and have you lay down now. All right. And do you mind if I lift the shirt?
Yeah, that's fine.
All right. Looking at her stomach, her umbilicus is midline. Her skin is true to ethnicity, color-wise. Her contour is flat. She does have one tattoo on her right lower quadrant. Do you have any tenderness while you're on your abdomen at all?
No.
No, okay. I'm going to go ahead and auscultate first using my bell side and starting with the right lower quadrant. And as I was moving, I went from the right lower quadrant to the right upper quadrant to the left upper quadrant and then to the left lower quadrant. The bowel movements were present, or bowel sounds were present, and they were tympanic, or normal, excuse me. Now I'm going to percuss. And the sounds over her organs were dull, and over the rest of her abdomen were tympanic. And now I'm going to palpate. Let me know if any tenderness. There's no bulging or any bruising. Any tenderness? Okay. I believe you can go ahead and sit back up. Oh, I'm sorry. I will have you lay back down one more time. I did forget to get your renal and iliac arteries. So I'm going to use my bell side still and listen to her renal and iliac arteries. Her aortic would be right about here. And the renal. And then for the iliac. And there are no signs of any bruise. And you can go ahead and get up. Next, I would make sure that my patient has everything that she needs and has a call light accessible to her, non-slip socks, and that she was comfortable. Then I would go ahead and document all of my findings.